Good evening and welcome to When, Where, and How Community Immunity. This is a series of regional programming where we're going to be talking about how different areas of the country are being impacted specifically with COVID and the COVID vaccine acceptance. And so we're going to be talking to local officials, local elected officials, local health officials, some national officials, really breaking down specific areas around the country that have been impacted by COVID and may or may not. If it's an area that's doing well in terms of getting Black and Brown populations vaccinated, we're going to talk about what they're doing well in each area. And if it's an area that's lagging behind in terms of getting Black and Brown populations vaccinated, we're going to talk about what needs to be done in order to get the right messaging, the right messengers, so those communities can have some vaccine acceptance. Again, it's always about getting people the right information so they can make an informed decision, because we know there's a lot of disinformation and misinformation out on the internet. So we want to make sure that you have the right information so you can take it back to your friends and family and say, hey, no, this is coming from trusted medical sources that we know, and that's going to give us the right information. So before we get started, I want to make sure that we know where you're watching us from. So check us out in the comment section. Let us know where you're watching us from. We always like to see. Tonight, we're focusing on Atlanta, Charlotte, and Birmingham. So we're going to be in the Dirty South tonight, talking about what's going on. And we have a wonderful, wonderful guest list for you this evening. We have Dr. Gigi. Of course, you all know Dr. Gigi. She is near and dear to Black Doctor. So we have Dr. Gigi, and we're going to be talking about the vaccines in general and some of the new information that has been released from the CDC recently here, because we know that information changes every day. We also have Dr. Candace White Jackson. I'm so excited for y'all to introduce you to her. She does everything. You're going to see. She writes books. She's a physician. She works at CVS. She does everything and anything. And I'm so happy to have her here on this programming. And then we'll also have Dwayne. Dwayne Elliott Reynolds. He is the founder and CEO of Just Health Collective. Sorry about that, Dwayne. And he's going to be talking about some exciting things he's doing in terms of health equity and diversity and inclusion in healthcare, so we can really start breaking down those barriers and getting over, so we can be better equipped to treat Black and Brown and underserved populations. And we also have Senator Natalie Murdoch from North Carolina. She is an elected state senator there in North Carolina. We're going to talk about what's happening in North Carolina in terms of the vaccine rollout and acceptance. So we've got a big show for you tonight. So make sure you let us know where you're from. If you have any questions, make sure you drop them in a comment, and we'll try to get them answered throughout the night. We won't have to wait all the way to the end, but if I can work it into the discussions, I would definitely enter them, because this show is all about you and getting your questions answered so you can make an informed decision about being vaccinated. So I'm going to shut up because you didn't sign on to watch me talk. So I'm going to bring on our first guest, who is no stranger to Black Doctor. She is the founder of the Rodham Institute. She is also a member of the Black Coalition Against COVID. And she's also my co-host with our show called House Calls with Dr. Gigi. Welcome, Dr. Gigi. How are you?
Thank you. I'm fine. Just a couple of things I wanted to add to my title, if you don't mind.
Sure.
Professor of Medicine at George Washington University School of Medicine, Health Sciences, and also the Rodham Institute is dedicated to improving health equity in Washington, D.C., which is where I am. And of course, people tune in to see you, Mr. Elliss, because you are just such a wonderful moderator and you bring out so much information. So I'm going to correct you on that.
Oh, well, thank you for that, Dr. Gigi.
Sure, it's true. It's true.
I do appreciate the love. So we've got people from Louisiana and LA watching us. Thank you all for checking in. Keep dropping the thing and share it with your friends while we're doing. So quick question. First question is, Dr. Gigi, and we've had this discussion many times before, but Dr. Fauci recently was doing the graduation ceremonies at Emory University in Atlanta. He was doing it virtually, of course, but he talked about how the pandemic really exposed racist practices in medicine and healthcare. I'm paraphrasing, of course, but the pandemic really exposed those practices and racism that has been part of healthcare for a while. Do you think if there is a positive impact of the pandemic, do you think that really recognizing what has transpired in the past, and now people trying to do something to eradicate and create a more equitable health situation? Do you think if there's one positive coming out of the pandemic, that might be a positive thing for Black and brown communities?
Well, certainly. But I'm going to tell you, Dr. Fauci's sort of approach and his philosophy about inequity is not new.
Okay.
First of all, I'm of an age where I did my residency during the AIDS pandemic, and he was just an amazing voice, because at the time Ronald Reagan did not think that HIV was important. We look at how LGBTQ communities are treated now. There's still more progress that needs to be made. But back then, it was horrible, and how people were just completely shut out. He was a partner with that community to make sure that there was research and eventually testing and treatment. And actually, at the outset of the pandemic, he said, what's happening is just yet another example of how our Black and brown brothers and sisters, that's what he said, are being treated in sort of an unequal way, where they're really disproportionately paying the price. He also talks a lot about something called implementation science. So we have information about what might work well. Let's say blood pressure medications, okay, that work well. But how long, from a knowledge and a research standpoint, it takes for us to implement that can be 10 years. So what he is saying is that implementation science should not just look at the overall population, but should look at those communities that have been underserved for, in some cases, centuries, right? I think that, it's a silver lining. I think that's a big silver lining, because it's really taken off and unmasked the dirty secret that is really medical apartheid. Let's just call it what it is. And it's not just Henrietta Lacks, God rest her soul. It's not just Tuskegee. It's ongoing right now in real time. I can't tell you how many people I transferred from other hospitals that were African Americans that would have died because of the care that they were getting, right?
Wow.
So that's a here and now. The inequities are here and now. And anybody who's been in a hospital recently that's African American or, Latinx can attest to that. I'm sure there are many examples. So that is something, once you at least can recognize the problem. I'm not talking about us, because this is just the latest example of disparity. I'm talking about the larger system. Well, at least there can be the beginning of trying to resolve it. But I want to make the point, Mr. Elliss, that as I said, COVID is the latest example. But COVID interacts with all of those structural and social determinants of health that really account for 80% of health outcomes. So, mental health is one of them. I was in clinic this morning. People are really struggling. Well, what if you have issues with mental health? Well, that affects your immune system. If your blood pressure is not well controlled because the pharmacy is, 3 miles away and it's not open, well, that affects your immunity. The food that you eat, the stress that you have, all of these other factors stack up and put COVID is just sort of can be the proverbial final straw. And then just to wrap up, I think that, that enters into the conversation about vaccinations, because sometimes people have competing priorities where the vaccination is not at the top of the list. Getting food at the table, not making sure that you're not missing work, right? Taking care of multi-generational households. So when we're approaching this issue, and I'm kind of setting up the discussion for you in a way, we have to have that sort of broader context.
Well, let's talk about the vaccines, because one of our first commenters, Carla, kind of talks about her struggles with the whole vaccine situation and not knowing what you can do. And so that's kind of been the big deal. It's like a big question is like, okay, I go get vaccinated, but I still have to wear a mask. And so I noticed recently here, the CDC has been releasing some newer rules and stipulations for people that are vaccinated. So can we talk about a little bit of that so people can understand that once they become fully vaccinated, what they can do now?
Sure. Well, first of all, I think that the CDC may have jumped the gun already, and that's why you're getting some conflicting advice,
Okay.
because the healthcare community that includes the public health and sort of the clinicians and researchers don't necessarily agree with the official line. And so here's the issue. So I was at the first birthday party, for Miss Cora Masters Berry, the former First Lady of Washington, D.C., yesterday. It was outside. We had to actually send proof that we had been vaccinated, and it
Right.
was great. So that's okay. The issue is this: if you live in a state, and we'll hear from, of course, the local experts on the show tonight, that the rates of COVID are very, very high, and that people are not vaccinated, especially with some of these strains that are really, quite contagious, then it doesn't make sense not to wear your mask. I think
Okay.
if you're going outside and open air, and other people are vaccinated, then yes, you can go without the mask, because the possibility of you getting it is there. It's not non-existent. If you've gotten the vaccine, you won't die of it, but you might get it. And then in the reverse, the possibility of you passing it to somebody else if you had it, even if you were vaccinated, is also low. It's not zero, but it's low. So let's say that you're going to visit, a relative who's undergoing chemotherapy, right? And you've been vaccinated, and
Hmm.
maybe they have been vaccinated too. Out of an abundance of caution, you both should get masked, right? And that kind of nuance, I don't think is being discussed, because people are just, I don't know about you, but I can't take the mask. I really, it's hot, you
Right.
can't breathe, all of these things. It is
Right.
very challenging. So let's just start with that. But the thing is, we are still, some parts of the country in particular are more vulnerable. And you're hearing, like, some of the Starbucks and Safeway and all these other places, I may not have it quite right, are lifting the ban, right? But
Hmm.
then other places are not. So it's kind of confusing. But I would just say, if you have a family member that you live with, or somebody that you live with or are around, even if you've gotten vaccinated, or you're going to be around people in indoor spaces in particular that you don't know what their vaccine status is, wear your mask.
Right.
If you're around people that have been vaccinated, especially if you're outside and it's smaller groups, well, then you don't need to wear your mask. Does that make sense? Because it is so
Somewhat,
confusing.
it's tough. Because I think ultimately, I'm speaking personally, and probably for a lot of people, I'm tired of wearing the masks. Right? I've got several masks in my door of my car, and I'm just tired of having. And sometimes I forget. Like I'll start walking towards the door of a store or a restaurant. I go, oh, I forgot. I got to go back to the car,
Right.
grab the mask, and I think a good rule of thumb that I always follow is, even though, like, the state I live in, they're starting to release, relax some guidelines and things like that. But private businesses don't have to.
Right.
They can set their own rules. And so I think sometimes when people hear the CDC recommends, that they say,
Mm-hmm.
hey, I'm free to not wear a mask. And
Mm-hmm.
that's not necessarily true. So I want to make sure that we have that distinction. So always have a mask with you. If you're vaccinated, there's a good possibility. I know they've said that if you could go into restaurants without wearing a mask. You've got to check with the proprietor and that private business, because they can still set their own rules. I know that that's not a real answer that people are looking for, but
Mm-hmm.
that's as close as we can get. So there's another question. We're going to talk specifically about the vaccines. I know we ask this all the time. We know they're safe because over 262 million and counting doses have been administered, with very minuscule number of effects. And so I think the safety concern is being addressed every day. Every time somebody gets a vaccine in their arm and they don't have a severe reaction, that's a safety issue. That's another check in the safety block. But we've got a specific question that if somebody has an issue of strokes, and we know what's happened with the Johnson and Johnson vaccine, if they have a history of strokes, should they just avoid getting the Johnson & Johnson vaccine, or should they contact their medical provider?
Yeah, and remember that all of these answers are answers that you have to run by your clinician, right?
Yes, yes.
Because I don't have the full story. But so just to add to what you said, Mr. Ellis, there have been 260 million doses administered in the United States and a
Yes.
much higher amount that's been administered worldwide. So to the individual that asked that question, first of all, I hope you've recovered from your stroke in 2016. That is, very upsetting, and I hope that you've gotten good rehabilitation. Yeah, if I were you, I would probably stick with Moderna or Pfizer, not because I think that the risk is high. Remember that there was 1 in 7 million people, but why take a chance? If you're that one person with a history of stroke, why chance it? So yes, I would recommend that you talk to your clinician, and probably if it were me or a family member, that's what I would recommend. And I'm going to say a disclaimer.
Mhm.
Everything that I say, I have to apply that rule. And that is, would I recommend it for myself or for my family members? So everything, all the advice that I'm giving you has to follow and pass that test.
Right. And so for Carla, I understand that what we're saying is a little bit confusing. It can be a little bit confusing, but I will say this is that there was an article in the New York Times over the weekend. I think I got it today that kind of broke it down into four groups: what fully vaccinated people can do, what partially vaccinated people can do, what families, and there were four groups, and it talks about specifically what you can do, and it's got the references and the resources. So I would say go check out that article. It's a wonderful read. We're not getting any money from the New York Times. It was a great article because I'm always trying to find new information to be able to share with people. And so I
Yeah.
would say
I,
check that
I
out.
would also add, please go to the Black Coalition Against COVID. A
Yes.
lot of great information. So it's one word, blackcoalitionagainstcovid.org, and maybe we can put that in the chat. It is confusing. I get it. And I wish that it was simpler. But again, I'm going to say, if you or a loved one have a high risk condition, right? Diabetes, cancer, have had a stroke, have sickle cell, have lung disease, kidney disease, it makes sense to just have that extra layer of insurance. Use the mask and make sure that you're vaccinated. Those two things together.
Last question I'm going to ask you, and then we're going to move on. We're going to get to some of our other guests, but we're going to have you stick around because we're going to talk to you later on in the programming. But there's been a big question about fertility in among women in terms of some questions about, hey, is it going to mess with my ability to have children? Is it going to impact if I'm pregnant? It's going to have an impact. And men too. Are afraid. Some men of color have mentioned that they were fearful of becoming sterile as a result of the vaccine. And now that we're talking about, now that the FDA has approved the use for children, ages 12 to 15. Now the next question is, will it have any impact on their development? Because we know that age, you're still developing. That's a big time in puberty. Are there going to be any impacts of the vaccine if people that young get vaccinated?
So very important question, very important concerns, right? So one piece of data is that there were several women that were enrolled in the clinical trials that became pregnant during the clinical trials and did just fine. They have healthy babies, they were healthy. And then when we think about what is the vaccine and is there a possibility that it could incorporate in your cells, the answer is no. So how the vaccine works is that, remember that old Mission Impossible series or the movie?
Mm-hmm.
You have that little tape and then Jim would get it and then it would like disappear. Well,
Right.
that's sort of how the vaccine works. You get information that's injected, which teaches your body to make the antibodies. And then in a few days, it disappears and your body takes over. So there's nothing that incorporates into your DNA, okay? Nothing that will impact your fertility or, ability to have children and so forth. Now, I say this, and my 13-year-old niece is going to get vaccinated. So I'm not saying this lightly. My other niece, who just flew in, from out of the country is going to get vaccinated. She'll be turning 30 this year. So these are not questions to be taken lightly or dismissed. I will say this, though, just to give us some context, because I think, and it's natural when there's something new like a vaccine that we look at that. If you're concerned about your fertility or birth defects, alcohol is much more of an issue. Some of the medications that people take, right, over the counter are going to be much more of an issue. And small amounts of alcohol, meaning beer, wine, or hard liquor, even as little as a couple, 3 drinks a week, can impact and cause defects, birth defects. So just to kind of give that perspective.
Right. Well, you're always here to give us some perspective, Dr. Gigi. That's why we have you here so often. And so we're going to ask you to hang around and move on to talk to Dr. White. But thank you for that. And we're going to answer some more questions. Keep your questions coming. I'm going to try to work them into the program as I promised earlier in the show. So keep your questions coming as we move on in tonight's discussion. So next up, we have Dr. Candace White. Dr. White, you're on mute, so I want to make sure that you take stuff off mute. So Dr. Candace White, I had to write all this stuff down because it was too much. So she's a medical director at CVS Health. She's an adjunct professor at Emory University School of Medicine. She's also a physician at Emory Healthcare. And I stopped there because I was like, we only have so much time on this interview. So I wanted to say, wow, that's a lot. That's a lot that you do. And we're just happy that you had the time to come on with us tonight. Thank you for joining us.
Thank you for having me, Ellis. I really am so happy to be here because this is an important topic that you're doing here this evening.
So the first question is, with the CDC guidelines, and we just talked about it a little bit with Dr. Gigi, with the CDC guidelines changing almost daily, it seems, yes. How could we find some clarity regarding the advantages to getting vaccinated?
So first off, let's just start with the fact of the death toll, right? So it's so sad to report that we've lost over 3.3 million people worldwide and over 580,000 people in the US. And right here in Georgia, greater than 19,000, right? So we know that this is a huge global health public crisis. So with that being stated, so what can be done to hope to just eradicate and end it? And that's where the vaccine comes into play. Because as we've seen so far with the rollout of the vaccination, that we've slowed cases. And at this point, as you stated earlier, we've had over 262 million doses that have been given out, and over 116 million people at this point are considered fully vaccinated. So that's about 35.2% of the population now who has been fully vaccinated. And the goal is to achieve and reach a herd immunity. So the advantage is that it's not just about us protecting ourselves and our family, it's about protecting the community so we can get back to living in life. If we can achieve that herd immunity, which is, by researchers are stating, about 70% or greater of individuals who have become vaccinated, then we can protect everyone, right? And so, like you said, we are just exhausted. We have mask fatigue. It's just time to get back to living. And so that is the advantage. So we can have protection, prevent those poor outcomes that lead to the NICU, hospitalizations, and or death, and to just get back to life.
Well, amen to that. So as a practicing physician, what do you say to patients when they ask questions about how quickly the vaccine was developed?
Yes. Okay. Now this is challenging, especially I find in practice oftentimes, right? Which is what leads to that hesitancy. But I think what we have to keep in mind here is that we're talking about a global public health crisis. So the greatest minds, government, everyone came together, put these resources together into research and technology that is not new. Actually, it's built upon, decades of technology with this messenger RNA and even the adenovirus vaccines. And remember too, with these studies and the number of people who participated, whether that was Pfizer, Moderna, like with Pfizer, about 44,000 participants, about 30,000 for Moderna. It took no time to fill up these clinical trials because everyone was so desperate for answers and to get vaccinated so that we could get back to living in life. So it did not take nearly the years that it would typically take to get something like this done.
Amen. Okay. Well, it's amazing. So speaking about Georgia, the numbers from the CDC show that Georgia is behind regarding getting people
Yes.
vaccinated. Why do you think that is, and what can we do to encourage more people to get the information they need to make that vaccine decision?
Yeah, so I know that there was a study, Georgia State University published it, and the research showed that some of the lag came from like communication gaps, some distribution issues, as well as some technological challenges, right? But we
Right.
also have to keep in mind that Atlanta, Georgia, the population is what, 50% people of color. And
Mhm.
so, we also know that the hesitancy is there as well. So where are those massive campaigns that are putting your, political leaders and your healthcare providers in the forefront to also encourage people and educate them with this information? Now, I know that Emory has done a very good job of making sure to speak to the people in the Black and Brown community who have been disproportionately affected by the COVID-19 virus, right, and or deaths. I participated in a lot of those campaigns. And what studies have shown is when you can get people who look like you to deliver this information, to educate and empower, the health outcomes are favorable. Right. So, this is a multifactorial situation in regards to some health disparities and barriers also that play a role. I serve an underserved community. And what I find is that whether it's transportation, access to technology, being able to have a smartphone to go on and schedule these appointments, right?
Mhm.
It can really become overwhelming and daunting for the patients in the community. And so what do you have to do? Honestly, you have to insert yourself. I spend majority of the visit in the beginning, like on my phone, scheduling people, on my computer, scheduling people. And I'm happy to say that I have scheduled over 150 or so individuals that would not have had access otherwise. So again, those health disparities and those barriers, those socioeconomic determinants and factors play a role as well.
I'm gonna pause just real quick, and I'm gonna answer a question that's in the chat room from Charmaine, and she's asking why is India's rate so high? Weren't they not part of the world's rush to vaccine?
Mm-hmm.
And the answer is India has a very high population in a very small space, right? So in terms of the country, and a lot of their population live in smaller spaces. And so therefore they are, and multi-generational. So if you get, and there's poverty as well. So you add that as a social determinant. So when if COVID enters that situation, then it can pass very, very quickly amongst each other because they may not have clean running water, the food, there's all of those things that come into factors. And so therefore and access to healthcare
There we go.
in those poorer areas of that country. And so when COVID gets in there, it spreads very, very quickly, and you have high rates of COVID, and also coming with high rates of COVID, you have high rates of death. So that's the reason why that's the layman's version. Dr. White, you want to add on to that?
No, you've stated it. I mean, we're fortunate to live in a country where, although we also have our challenges, we have better access to PPE and to healthcare. Even though with COVID, though, we've seen a lot of burden, even in our healthcare systems that are being overwhelmed in NICU. Thankfully, with vaccination, all those things have improved. But we have better quality of care here in this country in comparison to places like India, which unfortunately lead to these other, waves that we're hoping they'll be able to get through with more support.
Absolutely, absolutely. So, in your role as a primary care physician with an underserved region here in Atlanta, in the Georgia area, what can you tell us about those efforts to get more Black and Brown residents vaccinated?
Yeah, for me, I find education is key. For the longest, I would get patients that would say, you know what, if you're not doing it, I'm not doing it. So I found that, and then just talking about it, I actually had to be the example. I needed to be a leader. And so I made the decision to get vaccinated, not only for the protection of myself and my family, but for my community and for my patients, because I understand that out of those 580,000 deaths, more than about 40% have been from Black and Brown communities, right? Because we have a disproportionate issues with chronic comorbid conditions such as diabetes, kidney disease, heart failure, COPD, end-stage renal disease, right? And it just goes on and on and on. So if you lead by example, then that also helps to build a trust because as we know, there are some issues that are deeply rooted when it comes to healthcare. So I
Right.
knew I could have the greatest impact if I went into the community and they saw that, I have nothing to gain other than to be that beacon of light and hope for you, and to go on that journey with you to reach the greatest care, to give you the greatest care that you deserve. And so that is through education and leading by example. And so that has been very, very beneficial for me. And then the leaders, of course, within this community also being an example, and them seeing them do that, then they're like, you know what? I guess it might not be that bad. She's still here.
Exactly. And that's the part that I'm still trying to wrap my mind around, is all of these people that have gotten vaccinated, they're still around, they're still moving around, they're not experiencing, and then you get the question you still get the question, is it safe? And I want to make sure that we emphasize that getting vaccinated doesn't prevent you from getting COVID.
Absolutely.
Vaccine is to help prevent you from not dying from COVID in terms of
Absolutely.
experiencing the more adverse effects. It doesn't prevent you from getting COVID. That's why they have been cautious, and what Dr. Gigi was referring to earlier in the discussion is about continue to wear your mask, because it doesn't prevent you from getting COVID. And you might not have the adverse effects, but if somebody's not vaccinated and you spread it to them, they may have the adverse effects, which is why they're still encouraging, some places are still encouraging mask wearing and usage. So I learned a little bit.
Thank you, because you did a great job. That was great. No, that's so true.
So I'm going to ask you one more question, and then we're going to get to our next guest.
Okay.
But I'm going to ask you to stick around so we can have our final panel discussion. So you wrote a book.
I did.
With all the stuff that you're doing, you wrote a book called Born During the Pandemic.
Born into a pandemic, a mother's precious gift. Get it right, Elliss.
Okay, I'm sorry.
Yeah,
I gave the short version of the title. I'm sorry. What inspired you to write that book?
You know what? As an expecting mother at the height of the pandemic, there was so much that was not known. So keep in mind that I was around 38 weeks pregnant, March of 2020, right? In the global health, it was the World Health Organization designated the global health pandemic like around March 11th. So nothing was known. They were telling me my husband was not going to be able to be in the waiting room initially. I may have to deliver alone. I'm a primary care physician. I had 3 exposures unknowingly at the time, pregnant. So I had a lot of different fears and anxiety, and I'm a very faith-based oriented person, even within practice. And so I channeled those fears into my faith, and I began to journal. And I have on my the baby who was born, her godmother said, you know what, you should put it into a book. And I said, you know what, you are right, because it can really be a keepsake and support for other moms and families who have experienced this. And so pretty much it has health and safety tips. It goes through the stories of what we all have experienced as expectant mothers, and then mothers who give birth, like what does it look like after the fact. And it also has tools to help you to have a safe and healthy delivery, with health affirmations, and just really being one with your body and focusing on the precious gift of life, even in these unprecedented times.
Well, amen to that. And I think your story, and we're going to probably have to have you back to do a whole show just talking about
I'm coming back.
vaccine and the fertility issue and being a mother, because I think that's a big issue for our population and our audience, because we've gotten those questions many times. And so for somebody that has gone through it, that there's no one better to tell it, because you can talk about the medical side, and you can also talk about the personal fears and trepidations that come with
Absolutely
being pregnant during a pandemic. So I'm looking forward to reading that book.
Thank you.
And I have and my childbearing years are over with. so thank you. So stick around. We're going to move on to the next
here.
Stick around, and we'll have our panel discussion. Thank you, Candace. So next up, we have Representative Natalie Murdoch. She is a North Carolina state senator for the District 20, which is Durham County. I think because our people that are watching from other areas around the country will say, what is District 20 in North Carolina, and why do I care?
Yes.
But that's Durham, and most people have heard of Durham.
Yes.
Durham County, North Carolina. Raleigh, Durham. It's a very, very popular, well-known area there in North Carolina. So you're right there in the thick of it.
Yes.
So how has COVID impacted North Carolina as a whole, and specifically your Black residents?
Yes, in so many ways. And thank you so much, Ellis. I have to still acknowledge what Dr. White was just referencing to. We actually worked on a phenomenal, expansive package around Black maternal health, and there was a provision around COVID-19. We also have seen and heard very frightening stories of women who've been pregnant and given birth during COVID. Unfortunately, I had a family friend who was pregnant with her first child, became positive with COVID, was hospitalized, unfortunately lost her child, was airlifted to the hospital, almost lost her own life. And so, we hope that we have seen the worst of this pandemic, but we just don't know with the variant. So do want to add, I think that's the entry point to basically stress to everyone, and we've seen it because we've been in this for a year. COVID really impacts every single solitary aspect of your life. What we've seen in the African American community, as so many other states, are just higher rates of infection. And I was just talking to a group today. A lot of it are the occupations that we hold. It's not only a lot of it is systemic racism, but it's the fact that a lot of us are frontline workers. A lot of us are direct care workers. We're still in these long-term healthcare facilities or hospitals, and we are, oftentimes the CNAs, the folks that are really, really hands-on with a lot of patients, a lot of retail jobs, a lot of jobs where you interact with the public to a great extent. Just saw a study to show a lot of cafeteria workers were really susceptible to COVID because folks that try to keep their kitchens intact. It was a lot of the servers that got laid off, but a lot of those cooks were still showing up to work, doing their job, becoming impacted. So we've seen multiple pandemics, economic recovery. I'm a small business owner myself, concerned about the ability for Black businesses to bounce back from this, concerned about just the gap we'll have with wealth generation as far as the lost wages of folks who have lost their jobs and are underemployed or either unemployed altogether. And then more than anything, just the disparities we've seen regarding getting the vaccine out to communities of color just have had challenges and gaps. And it's not just hesitancy, it is access to healthcare. Again, as Dr. White just mentioned, whether it's not having that primary physician to call, I was exposed twice. We continued to come to session here in North Carolina. So as a senator that was appointed last April, we never stopped working because we have to keep the government running. And so I still was coming to session and committee. And if members would get positive, we would isolate ourselves, but at least I had a primary physician to call to say, I've been exposed, I really need a COVID test. I'm a state senator, quite frankly, and was able to get a COVID test. Whereas, unfortunately, we had folks, you've heard the stories, waiting 4, 5, 7, 10 days just to get those test results. And they just couldn't afford to stay out of work for that amount of time. Women have taken a huge hit, so much job loss as a result of childcare, folks not being able to work since their children were at home in virtual school. Also has a disproportionate impact on Black women since we typically earn lower wages. So the African American community, it will take years for us to pull ourselves out of this pandemic, the effects of it.
Well, yeah, absolutely. I agree with everything, and I applaud you for your efforts there in North Carolina. And I'm going to ask you this, because when I looked at the map, right? So I went to the CDC site, I looked at the map, and I see the states that have the lowest acceptance rate for African Americans or for the vaccine in general, Black, white, or otherwise, are running right through the South, North Carolina, Georgia, Alabama, Mississippi, Louisiana, all the way over to Texas. Do you think that it has something to do with how the vaccine has been politicized, or why do you think that vaccine acceptance in the South has been so hard to get people to go out and get vaccinated?
Yeah, I think it's very complex and multifaceted. So first, North Carolina and a lot of southern states experienced that big wave at the beginning, where as soon as the vaccine was available, there was a huge rush where everyone wanted the vaccine, and we had very limited supply, unreliable supply from week to week. We did not know how much vaccine we were going to get. But I do have to highlight the work of one of my colleagues in the state Senate, a proud executive board member of the Legislative Black Caucus. So our first vice chair, Senator Gladys Robertson, has decades of experience in healthcare. And we worked backwards, and a lot of communities are doing that. We actually had to work to say, okay, if you are a leader of a Black church, and let alone your ministerial alliance, let's work backwards. Let's work with you. Give us a list from your churches, give us that list. If you're an active member of the community, if you can guarantee 200 people will show up for a vaccine, we will work to put 200 to the side. So we worked really hard at the state level directly with our Department of Health and Human Services. Dr. Secretary Cohen actually worked under the Obama administration, so we're blessed to have her as our Director of Health and Human Services, and our governor. They work lockstep, and we shared with them up front that we were concerned about these disparities. Initially, I think statewide acceptance rate in North Carolina for African Americans was as low as 10 and 11% when our state is 24, 25 or so African American. And so we said, that's not going to cut it, so we were very upfront. We were having weekly calls. They added on additional staff to try to figure out how can we do a better job of getting out the vaccine. So first, it was definitely an access issue of just not having enough vaccine to go around. Once the supplies increased, we started having more community clinics at your local churches, our HBCUs. We have, I think have the second most HBCUs nationally. And so North Carolina Central University is in my district. So we had clinics on campus. Duke University is also in my district. They had a number of clinics on campus. So our students worked really hard to get all of them vaccinated when it was their time. And now the challenge we're seeing really is we have a lot of supply and not enough people. So we knew that was going to happen. So now I think the marketing is really going to have to change, where you really have to be in front of this and really explain to people why they need to be vaccinated. Definitely be upfront about all the education and the risk, and being aware of their own healthcare situation. But we definitely have to continue to let folks know that now we do have the supply, and we really, really need you to get vaccinated. So because of all of our hard work in North Carolina, we're right around 40% of adults have received at least one vaccine, one dose. And we're seeing a lot more young people since Pfizer has allowed the vaccine, as you know, for folks that are 12. So I know a number of parents who still have not been comfortable still sending their children back to school. So really excited that we can now start picking up the pace with getting young people vaccinated as well.
I think that's an excellent point. I think your programs have done a great job, because if you were at 10% at one point, when I looked at the numbers today, they said about almost 18% of Black Americans in North Carolina are now vaccinated and at least have one dose, and so that shows that it's moving in the right direction with regards to getting people vaccinated. You're absolutely right. I think parents, I've talked to some education professionals, and they're feeling more comfortable, even though I know it's not going all the way down to grade school, but middle school and high schoolers can get vaccinated. And so I think educators are going to be still more comfortable going back to in-person classes, which will help alleviate some of the stressors that parents have had by trying to figure out what to do with their kids if their schools have shut down. So you're doing a wonderful, wonderful job. And I'm glad, I want to say this, I'm off script a little bit, but I'm going to say, I appreciate the fact that we have representatives, and that's why I wanted to have you on the show, because I wanted people to always talk about the government, what they're not doing. Right? They don't know what the government is doing until they talk to an active representative. So we're having you on to talk about what's happening in North Carolina, what the government there in North Carolina is doing. And it's not just all bad. The government's not all bad. They do work. Sometimes things get bogged down, yes. But when there is a cause as significant as this, people can come together and do a good job in the public sector. So I did want to give you that shout out. I also wanted to let you know that the reason why you're so connected to Dr. White is you're both are Deltas. And so.
Yes, see, I saw it in our spirit. Thank you. Thank you for confirming that.
So just wanted to go ahead and give y'all both that shout out. I know
Thank you.
In case this is going to be bad at me. But
and quickly, I have to highlight another congressional soar, Congresswoman Beatty. And the reason that I have to acknowledge her is she's chair of the Legislative Black Caucus, and she's using an acronym that I'm also using. As far as getting out the vaccine, as elected officials, we get out the vote, GOTV. Now we need to pivot to get out the vaccine. Now we have that population where it's literally going to take going to their doors. We have community partners. Action for NC is one of many, and they are literally canvassing door to door. We have another group, Latinx. They're going all over the state. They are canvassing to make sure folks know where to get vaccinated, the same way that we say, get out the vote. You need a voting plan. You need a vaccination plan. When are you getting off of work? When are these clinics available? Is there a walk-in clinic? Do you need an appointment? We have to really break that down to people, because now we are dealing with populations that want it, but still may just not know how to access it because initially it was so difficult. I think a lot of folks just gave up. So now we are in a phase where we have to be more proactive. And as elected leaders and local officials, we have to get in front of this and make sure that we're taking the initiative, being as aggressive as possible, whether that's funding for more community healthcare workers so that they can actually get out there in the community to do this work. That's what we're doing in Durham. We have to figure out a way to get this done. There are far too many lives that are at stake.
Absolutely. Thank you so much for that. Carla, we'll let you know what's in the chat. We're going to get that question answered for you. So thank you for joining us, Senator Murdoch. I know you have a hard stop at 7, so I'm going to be respectful of your time. So you don't have to join us on the roundtable discussion later on in the program if you need to go ahead and head off early. So just check out when you can. And we just want to thank you for coming here and sharing what's going on in the great state of North Carolina with us.
All right. Thank you so much, Ellis.
And our final guest for tonight is Mr. Dwayne Reynolds. Mr. Reynolds is the founder and CEO of Just Health Collective, but that's what he's doing now. So he has had a long career in terms of creating diversity and inclusion in hospital systems and medical practices and medical systems. And so he's like, you know what? I've been doing it for other people so long. I'm going to do it for myself. And he started Just Health Collective. So welcome to the program, Mr. Reynolds. And we'll start you off by saying, what is Just Health Collective and what is your primary reason for being in business?
Well, thank you so much, Ellis, for inviting me to be on. I'm really excited to be amongst this esteemed group of experts that you have invited. So I'll start by talking a little bit about Just Health Collective. We are a consulting and advisory services firm that helps health and healthcare organizations advance health equity and belonging. And by belonging, I mean the intersection of diversity, equity, and inclusion. So our goal is really to partner with organizations to assess their current state, to make recommendations, and then support them in their transformation through education, change management, identification and mitigation of health disparities, and then building in the structures to really drive accountability for change.
Well, that sounds really good and really important work, because I know we're smiling and we're laughing, but that work is much needed, as we talked about earlier with Dr. Gigi. So I'm going to pose the same question to you recently about what Dr. Fauci's comments, and he's talked about the pandemic has exposed the undeniable effects of racism in healthcare. And that's a powerful statement from one of the top medical professionals in the country. Do you agree with this? And can you point to some examples?
Yeah, I absolutely agree with what he has said. And I think, for us as Black folks, we certainly have recognized that systemic racism has been prevalent because we live it day in and day out. So it's not that he's told us anything new or novel, but the difference today is that fair-minded white Americans are really more aware and willing to call it for what it is. And so that actually gives me a lot of hope and optimism, because when people like Dr. Fauci start to speak out about these injustices, about the impact of systemic racism on health inequity, then we can begin to actually change the system. And so I'm cautiously optimistic, knowing how challenging this type of work is, knowing that it is not about one person or one entity, but really about a system of laws, regulations, policies, rules, individual behavior, institutional policies that ultimately are going to need to be evaluated, deconstructed, and put back together to create a more just and equitable system. So, I've been working in the healthcare space, as you mentioned, for quite some time, over 20 years now, and been an expert in health equity for probably about 8 years or so. And I think it's really important to understand that racism functions at both an individual level, an institutional level, and then a systemic level, which has to do with the policies and laws and history of racism in our country. And so we have to work at all three of those levels in order to really deconstruct the system that has marginalized different populations. And when I think about health equity broadly, it's not just about race as a factor, but about language, about sexual orientation and the marginalization of the LGBTQ community, about access. It's about many things. So it's sometimes a daunting task to think about how to solve for health equity. But I, again, am very cautiously optimistic that we can begin to do better.
So those numbers that we talked about in North Carolina and Georgia, and we've seen it all throughout the Southeast, do you think that kind of the South's history with regards to how it's treated its minority communities has played a role in kind of the distrust of the messaging regarding the vaccine?
Oh, absolutely. I mean, if we look at a map of the country and think about the areas that have the worst outcomes, health outcomes, we're usually talking about the South. And, that has to do with the history of the South and the continued sort of institutionalization of racism. And it can play out in very covert ways that are still having impact. So for instance, when we don't have Medicaid expansion, that has a major impact on communities of color. When we aren't properly allocating funding or creating laws that may actually impact one's ability to access healthcare, that creates health disparity. So I think the South has a ways to go in terms of really the political determinants of health and how we think about our politics changing and the involvement of marginalized communities in politics. And we know here in Georgia, that voter suppression is a real thing. Well, that has major impact on our ability to create policies and vote for policies that are to our advantage.
Amen. Well, the last question I'm going to ask you, and we'll bring everybody else back. You previously served as president and CEO of the American Hospital Association's Institute for Diversity and Health Equity. That's a big sounding title there. What are some of the best practices of hospitals you saw across the country with regard to creating health equity?
I appreciate that question because these are going to be important things for folks in marginalized communities that suffer health disparities to recognize and think about as you interact with the healthcare system. So first, it's critically important to know and see that healthcare organizations are collecting race, ethnicity, language, sexual orientation, gender identity, and social needs data. That is a baseline for understanding disparities that might exist. And so if organizations aren't collecting that type of information, then they likely aren't doing anything with regard to performance improvement around it. The next thing I'd suggest is community partnerships. The hospital alone cannot solve health inequity. There has to be partnerships with community-based organizations, government entities, other corporate organizations. Then we've heard a little bit about training earlier on in the discussion. So training around unconscious bias, anti-racism, cultural humility are really important things for healthcare organizations to be doing. And then finally, I would say increasing clinician and leadership diversity on the clinician side, recognizing that there tends to be concordance, which means that patients may follow your care protocols more easily. They may be more open and trusting in conversations. And then leadership diversity means that we have the right representation at those tables for strategic decision-making and resource allocation.
Well, amen to all of that. And I'm with you on that because I just as an aside, I went and got certified as a D&I, diversity and inclusion specialist, because I definitely am passionate about the work, and so I appreciate what you're doing, and glad you were able to come on this evening with us. So I'm going to bring back Dr. White and Dr. Gigi as we're wrapping up this program. We've only got a few moments here, but I know there was a question. What is in the vaccine? That's the big question. What is in the vaccine? We get that question a lot. So, Dr. White, Dr. Gigi, you want to take that?
So as we talked about earlier, the mRNA is a protein. Remember that the COVID is like a spiky ball. So right. The part of the virus that allows it to infect us is that spike protein. So it's basically a copy of the spike protein, not the actual COVID, but a copy that trains our bodies to make antibodies to it. And as soon as we start to get trained, then it disappears, just like on Mission Impossible, gone.
Right. And it's wrapped in a lipid nano something or other that
it's wrapped in a fat particle.
There it is.
Of course, fat dissolves, and so that all goes away. Yes. Mm-hmm. Oh, and I wanted to mention one thing I forgot that's very important. Mm-hmm. They've identified the preservative in the Johnson & Johnson that's causing the blood clots. So that's a very important thing. So they'll probably be able to take that out.
Kumiko, the entire the fat module, everything that gets shot into your arm, once your body starts learning how to fight it, it all dissolves and it gets passed through your normal processes of your day. I'm not going to get too graphic on that, but it gets passed out of the body once it starts to get, your body starts finding out and copying and figuring out how to fight that copy of the crown. So
can I just add one thing? And I'm sorry, I don't mean to hog up the time. For some of these models that we're talking about in terms of getting people vaccinated, I'd really like to call everybody's attention to the Black Coalition Against COVID's Racial Equity Handbook, because a lot of the different initiatives, including ours, are listed as exemplars, which is really a how-to book to get more guide anyway, to get more and more people vaccinated. Lots of great information.
Yes. Another way also to get more information, if people actually have internet access, would be the CDC.gov. They have the vaccine finder. You can actually call your local pharmacy. So for those who don't have internet access, call your CVS pharmacy, call your Walgreens, call Walmart. A lot of times you're able to call and get more information. And usually the message actually on the phone will tell you whether or not that particular location is providing vaccinations. And don't forget about your local churches. We have the Church of Berean Christian Church here has become a vaccine site. That's another way that we're really trying to reach the community, is by using a lot of the community leaders at places of worship. So make sure that you utilize those resources within your local community also for additional support.
Shout out to Temple of Praise, which has vaccinated 4,600 people. They
Amazing.
vaccinate 3 times a week.
Wonderful.
Well,
hey, Elliss?
Yes, sir.
I have a quick question, just because I have 2 doctors here. So I've been trying to convince, members of my family, my cousin in particular. She has had COVID, and I heard her worry or question is, does she need the vaccine even because she's had COVID and perhaps has antibodies now?
Yes. And actually, because the antibodies that are made as a result of infection, that response is not as robust as with the vaccine, number one. Number two, there's actually some data that with the long COVID, long haulers, 30% of them might actually get better when they get vaccinated.
That's great.
So the answer is yes, absolutely.
Okay.
Yes, and
now
there's a synergy.
Yeah, and there's 2 doctors who validated that she needs to get the vaccine.
Because there's a synergistic effect if you've had the actual illness, right? The antibodies, and you get the vaccine, that you actually have a boosted immune response. So
Excellent. Thank you.
Amen to that. So as we're wrapping up here, I wanted to say thank you to all of my guests. I want to say thank you to Valerie. We're coming. I'm sorry y'all didn't get a chance to do your Delta thing there, Candace, but Valerie Murdoch from North Carolina. I want to thank Dwayne Reynolds. I want to thank Dr. Candace White, and of course, always Dr. Gigi, most gracious Dr. Gigi, for participating in this discussion this evening. It has been wonderful. As we've talked about COVID and the vaccines, but we've talked about it, I think, from a holistic standpoint with regards to what government agencies are doing, what private entities are doing in terms of eradicating health disparities. And we've talked about the vaccine. We talked a little bit about mothers. So we're going to talk about that some more, Candace. We're going to have you back and we'll have you on Dr. Gigi's show when Dr. G and I.
I would love to come back.
We will have you on House Calls with Dr. G. I just threw that out there, Dr. G.
Absolutely. How's the baby? You didn't tell us how the baby's doing.
Wonderful. So she's 1 year old, and that was when we actually did the book launch to celebrate life.
Oh,
amen. So people, there's good news about COVID. I just want to let y'all know that it's not all doom and gloom. I saw some of those comments of people saying we're fear mongering. No, you're telling the truth. And I think as medical professionals and as a site, we have to tell you all we have to be most cautious, right? Because we want to give you information that's going to be the most safe for you and your family. So hopefully we've helped add it to your body of knowledge so you can make a good, an informed decision for you and your family this evening. If you want to reach out to any of these organizations or associations, these people, please let us know and we'll get you in contact with them. If you're in Atlanta, go see Dr. White. She is great. She's right there at the cab. So she's right there in the middle of our community here in Atlanta. If you're a hospital and you need some help with the equity, go talk to my man, Dwayne. He will take care of you. Of course, if you need to know anything about what the Black Coalition Against COVID is doing, especially in the DC area, but around the nation, you can talk to Dr. Gigi. So again, thank you all for joining us tonight. Hopefully we answered some of your questions, and we look forward to seeing you again soon.
Thank you.
Thank you.
bye.
Bye-bye.
Thank you.